Chronic obstructive pulmonary disease, or COPD, is the name given to a group of lung conditions which cause breathlessness. Chronic means that these are long-term conditions which cannot be cured, but they can be treated with a variety of medications which should prevent your breathing from getting worse. Obstructive means that the flow of air through the lungs is reduced by narrowed airways. And pulmonary means that it is to do with the lungs. In the past, people would be diagnosed with emphysema or bronchitis, but we now know that these conditions are similar and can be treated in the same ways. This is why we call these lung conditions COPD. Your lungs are made up of lots of branches which end in air sacs called alveoli. When you breathe in, oxygen travels down your windpipe along these branches and to the air sacs. The air sacs are surrounded in blood vessels. The oxygen passes from the air sacs into the bloodstream. The waste gas, carbon dioxide, then passes from the blood and back into the air sacs before you breathe it out. In bronchitis, your airways become inflamed, narrowed and irritated, which can make you cough a lot and produce lots of sputum or phlegm. In emphysema, the air sacs become baggier and can develop holes. When this happens, the air sacs trap air, which makes it difficult for you to fully empty your lungs whenever you breathe out. This can then make it hard to take a deep breath in. It also reduces the surface area of your lungs. Both of these conditions make it harder to get oxygen into your blood and carbon dioxide out. This can make you short of breath and tired. COPD is most commonly caused by smoking, which is why it is so important not to smoke. Even if you have already been diagnosed with COPD, you should quit smoking as it will help to improve your breathing. People with COPD often become breathless because they have difficulty emptying the air out of their lungs. You are likely to have a long-term cough, described as productive, which means you cough up phlegm. People with COPD are also more likely to develop chest infections. Effective treatments are available that will help you breathe more easily. There isn't any way to reverse the damage, but early diagnosis and treatment helps to prevent further damage to your lungs.